Hello, good evening to everyone. Am I audible?
Yes.
Yeah,
Yes.
okay. Thank you, Donna, for that kind introduction. An absolute delight to be here this evening, addressing all of you and sharing a few of my thoughts. And I was about to begin with, in my traditional style. I'm just going to share my screen with you. So give me a second to do this. Okay, yeah, so I wanted to start the traditional way with a little quiz, but unfortunately Marjorie beat me to it. So I want to ask you, what do you think is the largest organ in the body? Yeah, and yes, it is the skin. I am a dermatologist, so I have to proudly say that. So you will be impressed to know that the skin constitutes about 15 to 16% of your body weight in an adult. And that accounts for about, say, 8 to 9 kilograms of weight. Yeah, as against, say, the liver, which is the next heaviest organ, which just weighs about 1.5 kilos. So the skin is a very, very important organ. Unfortunately, the skin has been reduced to just an organ of glamour. You know, everywhere, many a street when I walk in Bangalore as well as in Dubai, we see so many beauty centers, so many laser centers, and one only thinks that the skin is an organ of glamour, but it's far more than that. Yeah, and this is seen by rising sales of skincare products, you know, despite unemployment, despite COVID, despite inflation, we've seen people spending a lot more on skincare products through the years. This is a snapshot of what the Indian scene is, and it more or less parallels what it is throughout the world. We've even had proposals being called off because of one's skin, and you know, women rejecting men because they have, you know, not enough hair on their scalp. So a simple example is about 6 years ago, I asked my nurse, she was going to see a prospective groom in India. She's from one of the South Indian states. And I said, so what are you going to look for in the guy? And she says, doctor, as long as he has a head full of hair and a nice mustache and beard, I'm happy. Yeah, so that's how important hair and skin becomes. But like I said, there's a lot more to the skin. The skin is a very important organ to maintain body temperature in conjunction with the brain. It's also an important sense organ. It helps us perceive sensations of cold and heat, pain, touch, pressure. It also serves as a first-line defense, you know, against germs from the outside, bacteria, fungi, against sunlight hitting our skin, toxic ultraviolet A and B entering into our skin and causing problems. It also makes our body water resistant. It inhibits water from entering into the body. It also prevents useful water leaving the body. And as we all know, the skin is a vital organ for vitamin D production. So that makes the skin a very versatile organ. So my objective today is to share a few tips about skincare and mainly to bust certain myths that surround skincare. So I've divided this into two parts. The first would deal with routine skin and hair care. And the second bit of the presentation would deal with myths about 4 random common skin diseases which I've chosen. A little disclaimer, and that is all views appearing in this presentation reflect my personal views. They're backed by science and experience. There's often no right or wrong in clinical practice. There are different ways to treat a same disease, and physicians may have a difference in opinion, and most often different opinions all tend to be right. Now, why I share this with you is because tomorrow when you consult a dermatologist and they tell you, you need to wear a sunblock indoors, I don't want you telling them, oh no, but there was a Dr. Rohini who mentioned that you don't need a sunblock indoors. Well, there are different circumstances and different advice can be given in these different circumstances. So starting with routine skincare, you know, I get 2 groups of patients. The first group are the easy to treat group. They come in with a definite skin disease or a definite skin concern. So I go through their history and do a thorough examination. We come up with the diagnosis. If required, there are a few tests. And then I tell them, about their disease, counsel them, and give them a treatment plan. So they're easy to treat. And then there's a second group, when I ask them what your concern is, and they don't have any specific concern. They have near normal good skin. And before I ask them anything else, they start, doctor, my routine skincare is this. In the morning, I use my Cetaphil cleanser, and then I use rosewater toner. I then apply my vitamin C serum, my vitamin K Isdin eye cream. Then I use my Cetaphil moisturizer. Some days I use the Bioderma moisturizer, and then I have my QV day cream. Over that, I put my makeup, a little bit of compact. And 3 hours later, I just rinse it off. I put my sunblock again. In the evening, when I'm back, I use my La Roche-Posay cleanser. And then at night before sleeping, I cleanse again. I use an exfoliator, a rosewater toner, and then I spot apply my ordinaries, niacinamide, and then there's retinol twice a week, and there's AHA, BHA twice a week. And by the end of this saga, I'm quite exhausted listening to the entire list of products that they've used. And to top it all, at the end of it, they come up with this statement, doctor, I'm so confused. What am I doing wrong? And that's when I jump in and I say, you're doing too much. Yeah, when somebody has near normal skin, the best is not to mix up too many things and mess up. So that brings me to the first myth. Is there really a routine skincare? And can it be the same in everyone? Of course not. There is no routine in skincare. Your skincare can change depending on whether you live in Bangalore or Dubai or Canada or Kashmir or Australia. Your skincare will change in summer versus winter. It will change when you're stressed out, when you're having your monthly period. So a lot of things change your so-called routine skincare, and you need to keep changing it depending on that. And remember, one size does not fit all. So not everyone needs to cleanse, tone, moisturize, and use a sunblock. For example, if a person originates from, say, Kerala, and in Kerala, they've never used a moisturizer because their skin has always felt nice and moist and oily. They come to Dubai, they probably need to use a moisturizer twice a day because they're always so dry. So your skincare can change. The second myth, and that's hot water is good for your skin. Well, hot water is definitely good to ease away all the aching pains of a tiring day, all your muscle aches, but hot water is never going to be good for the skin in terms of dryness. And regarding this, I tell my patients, it's something like, a vessel where you cooked a biryani perhaps, and there's a lot of ghee on the vessel, and you want to cleanse it. You put a little bit of cold water, the ghee or oil doesn't run out. Yeah, you use cold water multiple times and you use it with high pressure, say with a hand shower, and you see some of the oil slipping away. You use nice hot water, especially under pressure, the ghee or the oil slips away a lot faster. You use a lot of detergent, the oil goes away faster, and say you use alcohol on it, then you have no ghee or oil left. So that's the same thing with your skin. The more hot water, the more detergent you use, the more sanitizer you use, you're just going to dry your skin out even more. And that makes the skin less effective as a defense mechanism to ward off germs. It also causes a lot of dryness and diseases like eczemas. Another thing we dermatologists hate is antiseptic soaps are recommended by dermatologists. Well, what you see on ads for soaps, I won't mention names, but antiseptic soaps recommended by dermatologists, well, they're legally correct. As long as you have 1 or 2 or 3 dermatologists telling you to use them, the company is legally right. But what they don't tell you is that the dermatologist is under the payroll of the company. Yeah, you ask dermatologists in practice, 99.9% will tell you never use antiseptic soaps. There are a few circumstances where they may advise it, but in general, one should not be using antiseptic soaps on a regular basis. And why? Because our skin actually houses a lot of normal bacteria, normal fungi, mites. They live in peaceful coexistence and they share a symbiotic relationship with us. And when you use harsh soaps, they just don't dry your skin. They also destroy these normal bacteria and fungi, and that creates some imbalance that can result in problems. Okay, another one which parents, in fact, always complain about when they come into the clinic and children have dry skin. They say, oh, doctor, she never drinks enough water and that's why her skin is dry. So does drinking extra water moisturize your skin? No, a big myth. It does not moisturize your skin. What water does to the skin is that it maintains turgor, it maintains elasticity. You look fresher. Yeah, your skin feels more supple, but it never causes dryness and flaking when you don't drink water. So what causes dryness of your skin is basically a lack of oils in your skin. And what you can do to moisturize your skin is apply a moisturizer or prevent factors of weathering. For example, using hot water, using soaps, detergents, like I mentioned earlier, factors that will actually dry your skin further. Yeah, but drinking extra water, let me tell you, is very important to the body. Every cell and organ in your body requires water, but water is not required to moisturize your skin. A couple of myths regarding sunscreens, yeah, and this is something everyone in metros love to use. And a lot of people believe that the higher the SPF, the better the sunblock. So for those who do not understand the term SPF, it stands for sun protection factor. So it's a certain index that tells us how effective is a sunblock in blocking ultraviolet B entering the skin. Yeah, now there are different spectrums of sunlight. And part of it is what we call ultraviolet light. There's UVA, UVB, and UVC. Now, UVC is completely blocked off by our ozone layer. UVA and UVB enter. UVB is blocked off by cloud cover and say things like window panes and stuff. So when you're sitting inside a car, you don't have UVB entering. When you're sitting inside your house, you don't have ultraviolet B entering. But you do have ultraviolet A entering your car or your house. Yeah. So SPF is a measure of how well a sunblock prevents ultraviolet B. But most of the pigmentary disorders, most of the allergies to sunlight are caused by ultraviolet A. So if your sunblock only has an ultraviolet B protect, and that's reflected by the SPF, it does not necessarily make your sunblock better, even if you have a very high SPF. So what's better is what you look for on your sunblock, which should read UVA plus UVB, or something that says a broad spectrum sunblock. So that's important. The other thing is the number alone doesn't make a difference of your SPF. So it has been shown that an SPF of 15, that's 15, blocks off, say, 93% of ultraviolet B hitting your skin. Now, if you increase the SPF to, say, 30, you just get an additional 4% benefit. And you increase it to 50, just an additional 1%, that's 98% protection. And as you keep increasing your SPF, what happens is that the sunblock becomes heavier, it also becomes cosmetically less appealing, and it becomes more expensive. So is it really worth it? And luckily, by virtue of us being Indians, we are colored skins, we have natural SPF in our melanin, that's the skin pigment that protects our skin against sunlight. So it has been shown that if you use the adequate amount of sunblock, which is about, say, 1/4 teaspoon for the entire face, or 1/2 teaspoon for the face and neck, an SPF of just about 20 to 30 will suffice. And what's more important is that you club it with an ultraviolet A blocker as well, which you need to specifically look on your sunblock. I hope that's clear. If there are doubts on this, I'd be happy to answer them at the end of the talk. The next one, do I need sunblock on a cloudy day? So like I just mentioned, on a cloudy day, you still have ultraviolet A penetrating through. And if you have a condition, say melasma, that's a disorder of pigmentation, which is very common in Indian skins, Asian skins, Indians included, then yes, you need a sunblock even indoors. You need a sunblock even on a cloudy day. You need a sunblock even inside your car. So this is a myth which a lot of men come up with, that I don't need a moisturizer, it's a cosmetic. Well, I tell them if they have dry skin, a moisturizer is required just as much as toothpaste is required to brush your teeth. So when they ask me, how long do I moisturize for, doctor, and they have a problem like an eczema, I say, well, you don't ask a dentist how long do you brush your teeth for. It becomes part of the so-called routine skincare, and you need to moisturize. Another huge myth, it's not part of normal skincare, but I thought I have to bring it up because I have a lot of patients who show utter disbelief when I ultimately tell them that they have a form of skin cancer. The myth is that Indians do not get skin cancer. Of course, Indians get skin cancer. The fact is that Indians are relatively resistant to sunlight-induced skin cancers, though we are seeing that also on the rise. But most often, Indians are relatively protected because, again, of melanin in us. But we do get a whole lot of other forms of skin cancer. Sorry for a few grotesque images, but these are all patients I've seen in the last few years. In fact, unfortunately lost 4 of them to different forms of skin cancer. So skin cancer is a reality, of course, not as common as, say, breast cancer, cervical or oral cancers in India, but about 1 to 2 to 3% of all cancers in India, in Indians, are skin cancers. So if you see a rash that is persistent, and ladies, please note, we've had a lot of patients who come in, especially older women over the age of 50, 60, who are probably embarrassed to show their groin or tell their children about rashes over the external genitalia. Or if you have a skin swelling that's not going away, please consult your dermatologist and ideally get it tested. Many skin tumors look totally banal, look totally benign, but they end up being malignant. So coming on to the next part, and that's about hair care. Yeah, who doesn't care about their hair? So most patients who come, I'd say about 50% of patients who consult a dermatologist actually come with hair loss, or in case of men, in case of women, abnormal hair growth in areas where they don't want hair. Yeah? So before I start this section, just to tell you a brief bit about what the hair structure is like. So your hair grows out from this little root that's lying a few millimeters into your skin. So there's the papilla here, and your hair root emerges out, and what actually comes out is the hair shaft. Yeah, there's a little oil gland here called the sebaceous gland, and that's attached to the lower part, that's the hair root. So every hair in our body goes through a cycle. There's a growing phase, a transitional phase, and then there's a resting phase. So every hair falls off. And that's what the hair cycle is all about. So coming to a few myths about hair care. One is coconut and castor oil helps hair grow longer, hair grow thicker. Well, no oil you put on the surface is actually going to penetrate into the scalp or the body and reach your hair root area, and that's not going to promote hair gain. The fact that Keralites particularly have good hair is thanks to their genes. Yeah, it's not because of the coconut oil they use in their food or the oil they put on their hair. However, oil serves as an excellent conditioner. So when it is applied on the hair, it actually prevents harmful agents, for example, say air conditioning, strong winds, sunlight, hard water, from damaging the hair shaft. Yes, so oil can serve as a good conditioner, but it does not make hair grow longer or thicker. Cutting your hair makes it grow faster. The same goes for shaving hair, makes it grow thicker. I'm sorry.
Yeah, do you want us to hold the questions till the end of the entire slide, or can we ask?
I'm okay with anything. Perhaps at the end would be a little better so that we can answer them once and for all. Is that good?
Okay. Yeah, sure. Okay.
Yeah, thank you. Right, so cutting your hair makes it grow faster. Again, anything you do on the surface here is not affecting the root or what we call the bulge area that lies below, that actually gives rise to your hair. All scaling on the scalp is dandruff. Yes, so in fact, most patients who actually come to a dermatologist have a scalp condition called psoriasis. That's a localized form of psoriasis when it comes in the scalp that looks a lot like dandruff, but it's slightly different. So many patients are not even aware that they have another disease. So also fungal infections in children, say ringworm in children, can often present as scaly patches on the scalp, yeah? And that's not dandruff. Eczema, so patients who are dry everywhere can have dry, itchy scalp, and that again is not dandruff. So not all scaling on the scalp is dandruff. Okay, so patients who have hair loss are generally very scared to wash their hair because they feel that every time they wash their hair, they're losing more hair. So that again is a myth. Like I've mentioned, the hair goes through different phases. So there's a growth phase, a resting phase, and then the hair droops off. So when you have a head bath, what happens on that day is because of the manipulation of moving your hair around and shampooing, whatever hair is meant to fall off the next day or the day after all falls on that one particular day. So whether you have a head bath 7 days a week or you have it once a week, the average loss of hair per day will remain the same. So washing your hair more frequently does not cause hair loss unless, of course, you're pulling out all your hair. Okay, so this is another myth which patients often tell me, and that's I have a typical patient who comes with a rash, say on the forehead, on the ears, and their scalp is a little itchy, and there's some oozing. And I tell them, look, this is a hair color allergy. And they frankly deny it. They say, no, doctor, cannot be, because I colored my hair 5 days ago, and I've been using hair color for the last 7 years of my life. Well, that's the thing with hair color. So hair color allergy is caused by an agent called PPD, that's paraphenylene diamine, which is a known allergen. And unlike, say, penicillin or shrimp, yeah, or eggs that cause allergies very fast, say food allergies, you eat it and you consume them and they cause the allergy immediately, PPD is known to cause what we say delayed type of an allergy. Yes, so it causes allergies only after years of using them. So yes, hair color allergies come years after you use them if you are allergic to the ingredient PPD. It usually keeps increasing each time you keep using the hair color. It increases in extent. And it can also come in areas where you don't use the hair color, like I mentioned, on the ears and other sunlight distributed areas, like say on the forearms after some time, even though you've not applied the color there. So in such cases, your dermatologist may recommend a PPD-free hair color. So that ends the first part of my talk, and that's about routine skin and hair care. And I'm just going to quickly go through 4 random skin diseases which we see very commonly and myths regarding them. So the first is about acne or pimples. Yeah. So we see many a mother and father coming in and the daughter or son has acne and they say they don't wash their face properly, and that's the reason why she gets acne. So huge myth. And to understand this, I'm briefly going to tell you why we get acne. Yeah. So acne is caused by different factors. So to put these very simply, first step is that you have a little thickening of the skin around the opening of the hair follicle. And there is an increase in oil production of a few of the oil glands. And this is coupled by a certain bacteria that overgrows, which is a normal growth in your skin and oil, in your hair and oil gland. And then there is some inflammation. So these 4 factors contribute to penting up of oil and hair skin cells, dead skin cells. And that's when what starts off as a comedone or a whitehead or a blackhead ultimately becomes a larger pimple that's inflamed and red. There are a lot of other factors that contribute, and these are mainly genetic factors. There are hormonal factors that play a role, diet to some extent, and then a lot of other things, like say nowadays we have friction in the form of the mask in the COVID era, and we see that friction induces acne along the jawline. So does washing one's face improperly contribute to acne? No, it does not. Another myth is that acne has a certain age to come and go. So we see perimenopausal women, we see men in their 30s and 40s who have acne. So acne, unlike what one normally believes, does not occur only in teenagers. However, if you are a lady and you have acne starting for the first time or persisting after the age of 30, 35, you definitely require a multidisciplinary team of a dermatologist, an endocrinologist, and a gynecologist to review you, to assess you, to look for hormonal disorders, mainly what we call polycystic ovarian disease, which is extremely common. And there are other hormonal disorders. Excuse me, just give me a second, please. Right, so age is not a determinant for acne alone. Another myth is that acne only affects people with oily skin. Definitely not. In fact, there are a lot of people whose skin shines because of the oil on them, but they never have a breakout even during a period. And there are a lot of patients, especially in Dubai, who have bad eczemas. So their skin is really dry and they throw up pimples. And in fact, they become the toughest patients to treat because many acne-based preparations tend to dry the skin out. Can I use toothpaste on my pimples? Yeah, well, if you're lucky, nothing can go wrong and the acne can go away, but generally a bad idea. Now, toothpaste does contain ingredients like antiseptics and certain lathering agents and drying agents. So if you're lucky, like I said, the pimple may dry out, but there are instances where patients have come to me after applying these things and they've come with burns on their skin. That's left a mark and that's much more difficult to treat than the acne. Similar to the dry skin story, does drinking less water cause acne? Does eating oily foods cause acne? No, drinking less water does not cause acne. Nonetheless, I encourage everyone to have sufficient water. The role of diet in acne is not a very solid link between diet and acne, but there is increasing evidence to show that people who consume very high glycemic index diets, so foods that are broken down to release a lot of sugar in your blood, can worsen acne if you are susceptible to getting acne. So also dairy, because you have cows nowadays, when you need to produce milk on at industrial levels, cows are often injected with bovine growth hormone, and this can passively enter us and produce acne. So it's possibly prudent to reduce foods with high glycemic index, as well as a lot of dairy in patients who are a little more susceptible to getting acne. Yeah, another myth is acne will go away on its own, so treatment is not required. And this is something sad to see, actually, because we have a lot of people in their late teens and those in their 20s particularly, who are waiting to get married, and then they come in with bad scars and they say, please do something for the scars, doctor, I have my wedding in 3 months. Well, we have to remember that once a scar, always a scar. So treating inflammatory acne on time is very important to prevent scarring. There are effective treatments. Of course, we need to be prudent when it comes to treating, especially children. But yes, we need to make it a priority and treat acne on time to prevent scarring. I'll quickly move on to the next condition, and it's a pretty common disease. It's called psoriasis. This is not to be mistaken for cirrhosis. A lot of people pronounce this as cirrhosis. So cirrhosis is a totally different disease. It's a bad thing to have. It's a disease of the liver. It's irreversible. and caused by alcohol and infections and certain other diseases. The one I'm talking about here is psoriasis spelled with a P. Yeah, and this is a pretty common chronic immune-mediated inflammatory skin disease. There is a genetic basis to this disease, and we find it in about 2 out of every 100 Indians, so extremely common. Unfortunately, most people don't even know that they have psoriasis because they have it so localized, so they assume it's dandruff or dry skin. Psoriasis affects not just the skin, one can have nail lesions, can also have joint involvement. So the arthritis of psoriasis can mimic rheumatoid arthritis, it can mimic lupus arthritis and ankylosing spondylitis. It's quite difficult to diagnose psoriatic arthritis when it comes first before the skin lesions. But of course, once a patient already has skin disease, then it's easier to identify psoriatic arthritis in them. There is increasing proof to show that psoriasis is also linked with metabolic diseases like diabetes, obesity, hypertension, that's high blood pressure. It's also associated with coronary artery disease, heart disease, and strokes. So yes, psoriasis is not a cosmetic disease, it is a medical disease. So these are a few patients. What we typically see are these patches or plaques which are red in color. The redness is not so striking in skin of color, but this is what it looks like. They're all scaly. It can be localized to the palms and soles. That's called palmoplantar psoriasis. It can also affect the nails, often making it look like a fungal nail sometimes, and often mistreated as fungus of the nail, but that's part of psoriatic nail disease. Psoriasis, like I mentioned, can be localized to the scalp alone. So we call that scalp psoriasis, can mimic dandruff. Psoriasis rarely can cause mutilating arthritis. So this is a picture of arthritis mutilans. That's the mutilating form of psoriatic arthritis. And another rarer variant of psoriasis is when the body is full of pustules, like little pimples. That's a more serious form of psoriasis. It's called pustular psoriasis. So different varying manifestations of one disease. So a myth about psoriasis that I just don't like to hear is that there's no treatment for psoriasis and allopathy. Well, that is totally wrong. There are a host of treatments available, starting with creams, lotions, there's light treatment, there are oral medications, and of course, the latest treatment for psoriasis is something we call biologic therapy, which is so effective. It's a game changer in the disease. It can give one a 95 to 100% guaranteed clearance of skin lesions. The only unfortunate thing about biologic therapy is that it's very expensive, and that's why not popular in India still. But in resource-rich countries, we are using biologics very often, and patients are so happy that their lives have changed. And this is more relevant for patients who have severe psoriasis, where they've not been able to get married, relationships have broken off, they've not been able to get jobs because of psoriasis. So biologics have been a real game changer. So yes, there is treatment for psoriasis and allopathy. Well, a fact is that there is no cure for psoriasis, and that goes for many diseases in the body. Say, for example, diabetes. In most patients, there is no cure. You can control it. Yes, you can bring it under excellent control with diet and your lifestyle and medications. But, well, can I stop taking my medications? Most likely not. Yeah, so it does, psoriasis like diabetes just requires some kind of routine maintenance treatments. Another myth is that only adults get psoriasis. False again. I have quite a few pediatric psoriatic patients, and I'd say about 10 to 20% of patients actually get psoriasis, their first plaque, when they're about 15 to 18 years of age. So they first get their psoriatic lesion in childhood, but it's often not diagnosed because it's called dandruff, for example. Eating fish causes psoriasis. On the contrary, fish has omega-3 fatty acids, particularly salmon, mackerel, sardines. And these fish are very good for psoriasis, good for the heart, good for the skin, and definitely good for psoriasis. It's conventional to also prescribe omega-3 fatty acids, especially in the past, for patients with psoriasis. So in allopathy, we believe that fish does not cause or worsen psoriasis. Another sad myth, psoriasis is caused by poor hygiene. And this is mainly because patients who have psoriasis extensively are just flaking, when they leave. Some of them leave my room, I need to call housekeeping to clean the floor because there are scales behind them. But it definitely has nothing to do with poor hygiene. Yeah, it's an inflammatory skin disease, and hygiene plays no role. Moving to another stigmatizing skin disease, and that's vitiligo. So vitiligo is quite common. Again, in India, we have about 0.5% prevalence of vitiligo. And again, patients are quite ostracized. And this has to do with some bit of history, because in many ancient texts, religious and cultural texts, it's believed that vitiligo was confused to be leprosy, till the 19th century. And that's why patients with vitiligo were thought to be contagious, and they were stigmatized. But vitiligo is an autoimmune disease. So it's a disease where your immune cells, instead of protecting your body, start fighting against your own body. That's an autoimmune disease. And in vitiligo, the immune cells fight your own color-producing cells. Yeah. So it is an autoimmune disease, and it can be associated with other autoimmune diseases like diabetes and autoimmune thyroid disease. Myths about them. Is vitiligo contagious? Definitely not. Like I mentioned, it's a disease where your immunity is overacting. It has nothing to do with infection. Vitiligo is caused by certain foods. Now, here again, there are different systems of medicine, and no system is perfect or right. Yeah, so in allopathy, we do not believe that foods contribute to causing vitiligo. Having said that, in certain native systems of medication, it is believed that eating sour food, citrus fruits, milk, yogurt, eating fish, red meat, fish with yogurt causes vitiligo. But we do not have that concept in allopathy. We have a lot of vegans who get vitiligo who have never touched fish in their life. So vitiligo is not caused by foods. It's caused because of a genetic basis and because of an overplay of your immune system. Vitiligo always spreads, and that's because everyone knows Michael Jackson and they think vitiligo is an extensive disease. No, but on the contrary, most patients with vitiligo have very limited disease. They have what we call focal vitiligo. Imagine 1 out of every 100 to 200 Indians has vitiligo, but how many do you actually know? You don't, because even when they do have lesions, it's in a very hidden area like the scalp or, on the trunk. So most people do not know that another one suffers from vitiligo. So vitiligo does not necessarily spread to involve the entire skin. Another myth is that vitiligo never clears on its own. It's a very dynamic disease. It comes and it goes. It can go even without treatment. I have pediatric patients, those who are age 4, 5 years of age with little vitiligo patches on their eyelids. And I tell the parents, I said, okay, let's see, or I give them a very mild ointment. And they come back after a bit, maybe after 4 or 5 months, they come for something else. And they say, oh, doctor, that just went away. I actually was scared to put the ointments. I never used anything, but it went away. So vitiligo does not necessarily need treatment to clear. It can even clear on its own. Unfortunately, it can also come back without any obvious trigger. So the last part of my talk is something which is very common in India and common in the UAE as well, and those are fungal infections. So the picture you see here typically is what we call ringworm, is one of the most common skin fungal infections. A common myth and something we see practically, what people end up doing is that they pick up these OTC, over-the-counter creams to treat their fungus. And they think that cures the fungus. Well, In a few patients, they get lucky and the fungus doesn't get worse, but most of them come back to a dermatologist with increasing extent of lesions. And that's because these OTC creams also contain cortisone or steroid in them. So what the steroid does is that it suppresses one's inflammatory response, one's immune cells. So the itching, the redness of the fungal infection gets better. But it also suppresses your innate immunity to fight the fungus. And that's why the fungal infection ends up getting worse and it starts spreading. What started in the groin soon spreads to other parts of the body. Yes, so please do not use OTC creams for fungal infections. In fact, in India, there's a strong move by the Indian Association of Dermatologists to ban topical creams that contain steroid with antifungal as combinations, because they do more damage than good. Antibiotics are used to treat fungal infections. Definitely not. In fact, one of the risk factors to getting fungal infections is chronic or long-term use of antibiotics, especially with the growth of a particular yeast unrelated to the ringworm, but there's a yeast called Candida, which can come in women in the genital area and men and women in the mouth. And one of the risk factors for Candida coming is long-term use of antibiotics, because the antibiotic suppresses the normal bacteria that help to counteract Candida or the yeast. Yeah, and that's when fungal infections increase. What we use to treat fungal infections are antifungals. So I have a yellow, a black, or thick nail, so it has to be a fungus infection. Yeah, not necessarily, like I mentioned earlier. We get a lot of nails in patients who are psoriatic. They have thick nails that mimic fungal infections. There are other primary skin diseases like, say, lichen planus. There are infections of the nail, bacterial infections of the nail that are not related to fungus. And not all discolored, thick or black nails are fungal nails. So with this, I'm going to conclude. And I'm going to conclude with a little message. And this is to echo the sentiment of the Indian Association of Dermatologists and Venereologists and Leprologists. This is to state that we should never abuse steroid creams. Yeah, most of these are present in, like I said, OTC creams given by pharmacists or GPs to treat any odd skin rash. It may help you in the beginning, but there are loads of side effects, and steroid-induced side effects or steroid abuse is akin to alcohol abuse and alcohol addiction. It really messes up your skin. So please, anytime you're given a cream by a pharmacist, which I dissuade you from doing, but in case you're given a cream by a GP or a pharmacist, please ask them if it has a steroid in it. And if it does have a steroid, please do not use it without a dermatologist's prescription. With this, I'm going to conclude. Thank you for your patient listening, and I'm open to any questions that you may have.